Welcome to Dental IQ, a place where you're going to hear from some of the most accomplished names in dentistry. I'm your host, Fabio Alfieri, and I sat down this week with Hismile's very own Head of Research and Development, Dr Mauro Pascolutti. Mauro holds PhDs in multiple scientific fields and was formerly the lead scientist at the Griffith Institute of Glycomics. This week, we sat down and chatted through some of the challenges that Mauro faces when formulating the future of teeth whitening, and also the selection of advanced ingredients for more effective and safe whitening. Stay tuned and enjoy the podcast. Dr. Mauro Pascolutti, thank you very much for joining us on Dental IQ this week.
Oh, thanks you very much for having me. I didn't have to travel too much. I was just 10 meters down there.
I think I can see your desk from here. No, I'm glad it was convenient for you. Mauro, when it comes to product formulation, you are the grand wizard in this space at the moment. And there's heaps I'm going to pick your brain about in terms of what it's like actually developing the future of teeth whitening and also oral care and cosmetics as well. But before that, there's a lot of our listeners who aren't going to know much about you. So I kind of want to get started right at the beginning.
Yep.
You'll hear a lot of Mauro's thick accent on this podcast because he is born and bred in Italy.
Yes.
Yes. So Milan, Italy, right?
Yes, exactly.
Right. So you've got a few PhDs under your belt, and I'm assuming that education process kicked off in Italy.
Yeah, kicked off in Italy. I went to university studying chemistry. Then I did a PhD in organic chemistry. And after that, I didn't really know what to do in my life. So I decided to pack my bag and travel to Australia.
Right. So university in Italy, got your first PhD whilst you were there as well before coming here. What type of student were you? Were you always very sort of obsessed with the chemistry side of things? Were you, very book smart?
I would say I was not book smart. I love study. I love learning every day. But I have to honestly tell you one thing. I never cheated during study. There was only one time that this happened. And
hopefully it wasn't getting your PhD. That might be concerning.
Nah, that was early stage. And I think my mom still has a photo back home of that day. So it was the day of the final exam to go to university, before going to university and high school. And I was very, very good in scientific subjects, and I was very bad in Italian.
Italian being literature, I'm assuming.
Literature, yes.
Right. Okay, so our version of what English would be.
English, exactly. Yeah. So, and unfortunately, I had to pass this, and I was sure that if I didn't cheat, I didn't pass. So I had to take that.
That's fair. That's a fair enough risk to accept, I think.
Yeah. So, and usually we, in Italy for the exam, we have to write essay. And usually it's 2 hour writing essay. And we have around 100 or 250 topics which would be picked for that day. And we knew the topic, the 150 topics. So I decided to print in very small notes each of these 100 topics.
Wait, how small are we talking?
We're talking this size.
All right, for our listeners, Mauro's holding up about 5 centimeter gap.
5 centimeter, 5 by 5, very small printed. I spent a month to prepare it because but that was the only way for me to pass. So I printed this 100 essay, and I stapled them all into my shirt, inside of my shirt. So I had a t-shirt and a shirt covering it. But the smartest part was on my dictionary, because you were allowed to bring your dictionary during the literature exam. I put a map indicating each specific position of each topic.
In your shirt?
In my shirt.
So there was a map in the dictionary that you would refer to once you got in the exam, and it's okay, it's this topic, and you go, okay, I know that's row B and number 7 in my shirt.
That's it was the only time I cheated.
Oh, that's, you know what? I feel like if you can cheat as clever as that, you should be allowed to cheat. That seems fair to me.
Yeah.
Right. So since the cheating fiasco in high school, then you went on to study your PhD in
Italy. I started to study chemistry, which was general chemical science, and then I started to do. I did a PhD, then moving that after studying the PhD in Italy, it was a time where the chemical industry was not very strong. So it was very hard to find jobs unless you were recommended by someone. And I didn't know many people in the industry. So I talked to my mom and dad and I convinced them to buy me a ticket to come to Australia just for a year travel.
Wow. How old were you at this point?
24.
So 24.
24, almost 25.
So what year is this?
2007.
2007. So
4 November 2007.
Right. So you're in Australia. You're broke, I'm assuming.
Broke, yes.
Broke, yeah. You barely speak any English whatsoever.
Oh, I could not speak English. The only thing I could read and say was stop, because I learned from the road sign.
The stop sign. Okay, so you're in Australia. You speak one singular word of English, and you have a PhD.
Yes.
Right. So talk me through what was your first steps in trying to stay in Australia?
The first step was I started to work as a waiter in an Italian restaurant, but I was not that good because I could not speak English, so I could not entertain clients. So I moved back into a kitchen and cutting potatoes and carrots.
With a PhD.
With a PhD, yeah. And after that, in the meantime, I met my current wife, I would say it was the early stage of our relationship. So I really want to stay in Australia. And I decided that the only way for me to extend another year was to go to work in a farm. So I traveled a couple of farms, banana and mandarin farms. And that was for 8 months.
8 months?
8 months, sleeping in a van.
Wow.
And with my best mate. And so we initially, I missed a step. When we came to Australia, we were for best friend. 2 decided to come back after a couple of months because they couldn't handle I guess there was the cultural difference between Italy and Australia without speaking English.
Right.
And the only guy that stayed with me is still currently here in Australia and lives in Sydney, Valentino.
Right. So at this point, how much English do you speak?
None.
Still none.
No. I decided to learn English by myself. I bought books, couple of books, and at nighttime. So we used to wake up at 3:30, 4 o'clock, start picking mandarin or bananas, depending on the day, and finish at 4 o'clock in the afternoon. So we had an afternoon studying a couple of chapters of English, and this lasts for 8 months. After that, I was able, I guess, to have an okay conversation.
Right. So from that point in time, where does your education then kick off again?
Because I could not work in a farm for my life. So
you're a failed waiter, you're a failed farmer,
yeah.
But somehow you've got multiple PhDs as well.
So what happened was to try to study in Australia was to become a student, and I thought, I need to pass the English test. So I studied to pass the English test. I passed the English test and I started again a PhD in drug development or drug discovery at the Institute for Glycomics in Australia.
Right. So since graduating that, what was the first job that you had directly out of university?
I work as a research assistant
at
Institute for Glycomics in Australia.
Oh, okay. Right.
Yes.
Right.
And after that, I moved to Brisbane at the Skyting Institute, which is another, let's call it, research centre.
Right. And what's it like working with the glycomics department?
Very good. I really enjoy my time. But after trying this experience, the only thing I can say, scientists are different breed. And I really love working with the community that I'm in now.
Right. Well, that's good to hear, because I'm sure the community is very happy to have you at least.
Oh, thank you.
Right. So you're at the Institute of Glycomics, right, as a senior researcher. Yep. The next step from that role was into Hismile's front doors, wasn't it?
Yes.
Right. So how long were you actually with Griffith University for?
Around 10 years.
10 years.
In different part of Griffith, different campuses and different institutions.
Right. And at this time, what was your knowledge like on the dental industry? Zero.
Yeah, I didn't know much about it. I used to have my teeth cleaned every 8 months to a year, and that's about it. Yeah.
Right. So that transitional period between going from the Institute of Glycomics, which is wildly different from what the industry you're currently in, to joining Hismile's team, What was that journey for you like, trying to become accustomed enough with this industry that you could hit the ground running?
I was very lucky because I had a 4 to 5 months buffer before I decided to change industry. So, and of course, I promised myself when I start a new job, I need to be up to speed for the current industry. So I study, let's call it dentistry in general, what's involved in oral cosmetics, the biology, the physiology around oral.
Right. And in that period of learning about not only just teeth whitening, but the entire physiology of sort of oral care and the oral environment and so forth, as you were starting to dig deeper on teeth whitening specifically, what were some of the things that were coming up that were sort of most intriguing to you, or even concerning as well? What were some of the flaws you sort of saw in the industry?
So when I was reading, because the first thing a scientist does goes back to the published articles, and there are a lot of articles where they collect clinical trials about hydrogen peroxide, carbon peroxide, sodium perborate studies regarding their efficacy, and you can't doubt that. It's very efficient oxidation ingredient. But the issue that I found looking at the first couple of papers was the side effect, short-term and long-term. And then when I start to dig deeper, you realize that the industry, and I guess the common person, doesn't know what's involved in teeth whitening.
Right. They think it's just, I'm going to experience a bit of sensitivity and
exactly.
that will eventually go away without actually understanding why it's occurring.
Yeah, exactly.
Okay, so whilst doing this research, tell me about some of the concerns that you were coming across with the current teeth whitening industry. What were these adverse effects?
You could tell that there are two types of the adverse effect. An immediate adverse effect, which were sensitivity, and long-term adverse effect was demineralization and also gum bleaching due to the leaking of the gel. Right.
So obviously these are effects that are mitigated when you have whitening done at the dentist, right? Because dental professionals have access to gum shields where they can cover the soft tissue in your mouth. Also, the effects on the enamel as well can be mitigated from boosting the pH level of the formulation. Yeah. So dentists have access to a dual chamber syringe, right? And in one side, you've got your whitening formulation, typically hydrogen peroxide. And then in the other side, you've got a pH buffer. So potentially sodium hydroxide. And when pushed through the syringe and these two formulas combine, it boosts the pH significantly, which is avoiding a lot of the potential risk of using peroxide on your teeth.
And also, so I stopped you there, increase the efficacy.
So higher pH levels also increasing the efficacy of the formula. Right. So these are all things you have access to as a dental professional, or if you go get your teeth whitened with a dental professional. I suppose the concern is when you don't have access to these things. And everybody these days has the ability to go on and purchase a teeth whitening kit from overseas. And that's dangerous because some of these kits can have 35% hydrogen peroxide.
Definitely.
Which is well above the legal at-home limit in Australia. So I think the concern, if you agree, is that applying levels of peroxide to your teeth and gums without the access of that shield can deteriorate your oral health massively.
Yeah, in fact, if you look at, we have done a simple market analysis of product, and 9 out of 10 of take-home product, they have a pH below the critical demineralization point, which is a pH 5.5, which is pH below which the enamel start to demineralize.
Right, so below 5.5 is the point where the enamel becomes soluble, right? And then those important minerals that are dissolving away. And I mean, at the end of the day, the enamel doesn't have the ability to naturally rebuild itself. So, I mean, over time, if you're doing this over and over and over again, that damage is becoming permanent. And now the sensitivity is not just short term, right?
It's a long term.
It's long term. Yeah, right. So understanding these sort of things, can you tell me a little bit about what Hismile does differently and specifically what you do differently in terms of formulation at the research center? Yeah,
so our goal was to create a product that was able to whiten your teeth as well as be 100% safe without damaging the enamel and damaging your oral soft tissue, which is gums and tongue and gingivals.
Right. And how have you achieved that?
We did.
Mm-hmm.
We did. This was a long process. It was not easy. It was a very big roller coaster. But we are able now to achieve a very good performance with our current PAP Plus formulation.
Okay, so for the listeners at the moment who aren't aware of what PAP is, can you tell us a little bit more?
PAP is, in chemical wording, is phthalimide peroxycaproic acid, which is a peroxy acid.
That rolls off the tongue nicely.
Yeah, especially with the Italian accent.
Right, so phthalimide peroxycaproic acid.
Yeah, let's call it PAP for me. It's easier.
Nice and easy. Got you.
So PAP is an oxidant as well as hydrogen peroxide or carbon biperoxide or sodium perborate. But however, the mechanism of action is totally different, where hydrogen peroxide oxidized molecule which are responsible for staining your teeth in using through a radical mechanism, where PAP oxidizes the molecule through a generalized epoxidation mechanism.
Right. Let's talk about the radical mechanism for a second, as you just mentioned. So hydrogen peroxide widens through a process known as the free radical mechanism, like you just said. And during this process, dependent on the oral environment, there is a release of a variety of
radicals.
Right, superoxide radical, hydroxy radical, and so forth. Okay, so these radicals are very good at reacting with tooth stains.
Oh, they're incredible. Yeah.
But they also have the ability to convert your minerals.
Yes, and this is all depends by the pH of your oral cavity.
Right.
I would say 9%, like I said before, 90% of the time, the home tech product, they are very acidic. Mm-hmm. And therefore, these radicals, they are able to strip the top layer of your tooth surface and allowing a exposed dentin.
Right. And I suppose by doing that, it's referred to as etching, I'm assuming. Okay, so this etching effect, if I'm using peroxide over and over and over and more etching is occurring, ultimately I'm just revealing a lighter color of untouched tooth below that surface layer.
Exactly,
right? So realistically, will PAP be as effective as hydrogen peroxide at whitening?
Yes. Mm-hmm. So PAP itself, no, because there are, I would say there are a couple of companies around the world that use PAP, but they are not able to achieve the same result that we have achieved with the PAP Plus. PAP Plus is a combination of certain ingredients that allows safety and efficacy.
Right, and that's what I was going to ask, is because ultimately if you use peroxide every single day for 2 months, that etching effect is always going to reveal a wider shade of tooth.
Oh, of course.
Whereas PAP, because it doesn't cause that etching effect, realistically, it is giving you the absolute whitest shade of natural white that you can achieve.
Natural white, yes.
And I suppose at the end of the day, that's the goal, because we never want to have to sacrifice our health for a cosmetic benefit. I think that whole concept of beauty is pain is dead now. And I think especially dental professionals, should never endorse that, which they don't. So to have an option like PAP that can actually provide a healthy, natural shade of white without compromising your enamel, it's game changer.
But also, I give you this example. In-chair treatment, which is the one you get at the dentist, you require to apply a gum shield to prevent gum burn, where with PAP you don't need. So its very advantages of the PAP formulation is to not interfere with soft tissue in your cavity. Therefore, it's going to save 20 minutes, 15 minutes of the dental.
Right. So saving dentist time is a big thing. This is not applying the gum shield. But I suppose also as an at-home option, it's now safe to use on the soft tissue in your mouth. And you don't have to have that concern of bleaching, burning, blistering that often comes with the use of high percentages of peroxide.
Yeah, I agree with it.
Right. So going back to the PAP Plus formulation, so PAP Plus being the coined term of what the formulation is as a whole. Yeah. PAP being the active whitening ingredient. What else is in the formulation?
We have a hydroxyapatite.
Right.
Hydroxyapatite is, let's call it, it's a source of calcium. Is a calcium phosphate mineral, and is used to remineralize area of your tooth surface which have been previously demineralized due to lifestyle or even previous teeth whitening treatment.
Right, so it's a synthetic hydroxyapatite.
It's a synthetic mineral which deposit in the little, in the little holes which are the demineralized area of your tooth surface, and it prevents further sensitivity.
Right, so as opposed to treating sensitivity, it's preventing the sensitivity.
Right?
Exactly. So those external factors can't actually make their way through the layers of the tooth because hydroxyapatite's sealing that layer. Right, and anything else?
Yeah, we use also potassium citrate. We decided to use potassium citrate because this incredible ingredient has a dual function. So not only function as a great pH buffer, but also has a great ability to reduce pre-existing sensitivity you might have in your teeth.
Right. So they're the three key ingredients that make up PAP plus, and then plus everything else that.
Plus, we have AVC or AVS, depending on the type of formulation you need to use, but which is a binder, and then you have the solution or the formulation is predominantly glycerin based.
Right. So essentially, there's three active ingredients, which are your hydroxyapatite, PAP, and potassium citrate. So you spoke a little bit before about pH and pH, the pH level of a formulation being very important to the process itself. What is PAP plus sitting at?
So PAP plus during the manufacturing, we try to keep the pH between 6.3 to 6.8. And at the moment, after we have done studies, of stability study, and we can see after 16 months, we are sitting at 6.2, which is fantastic.
Yeah, that's, significantly above the 5.5 critical point of demineralization. And you said before as well that pH being higher also impacts the results seen from the formulation. So what stops us from making that pH 8.5 or 9?
The reason why we are using a pH we work on a pH between 6.7 is because if you can create a formulation that has a pH 8.5. However, you compromise the shelf life, which I would say if you look at we have done studies that if you have a formulation at pH 8.5, the peroxide lasts around between half an hour and an hour. So the shelf life is very short. Right.
So essentially, higher pH means more effective but less stable.
Exactly.
Lower pH means more stable but very acidic. Very unsafe. Yeah. So it's a bit of a seesaw. You want to try and find that perfect balance, which is what I'm assuming 6.3 to 6.8 is for us, is that perfect balance between the two where, again, we're an at-home teeth whitening business. So this product needs to be manufactured, shipped, stored, and so forth. So stable for over 16 months at 6.3.
6.3, 6.2 depends.
Yeah. That's incredible.
Yeah.
Right. So in terms of what the future looks like for PAP plus, do you think there's an option for a dual syringe similar to what peroxide is used as with a pH booster?
Definitely.
But for PAP?
Definitely. We have been working in the last couple of months to develop a dual chamber syringe, which would be able to bring the pH of the final formulation to an optimal pH for oxidation.
Right. Wow. Well, speaking of what you've been working on in the lab, because, we kind of want to give the people what they want here. I would love to hear a little bit about what you're currently working on in the lab without giving away too much naturally. But, so the dual chamber syringe is really interesting because that's a solution for in-chair whitening.
That would be only in-chair, yes.
That doesn't require gum shields. More effective whitening.
Save time of the dentist.
Exactly, right? So what else is there? Because I overheard the other day that you were telling a story about the oral environment being a very important foundation.
Yes. So we are looking on different fronts. One of them is introducing probiotic in oral care product. There are a couple of brands out there that use probiotic, but we want to introduce probiotic in oral care as a routine, not one-off. And we know that balancing the good and bad bacteria it's very important in your mouth. And we know that there is a certain type of strain, of probiotic strain, which is able to improve your microbiome in the mouth.
Okay, and for people who aren't aware, why is improving the microbiome important?
Is because it's going to reduce the possibility of having caries, and also bacteria generate acid. They live in acid. So of course, if you are going to, again, it's all about rebalancing the pH of the mouth. So if you are able to rebalance the bacteria, there will not be as much as acidic media,
right?
And therefore you reduce demineralization,
right?
And this, also, of course, will also be involving in the gum health.
Right. Okay. So, because at the moment I take a probiotic for my stomach, right? I feel like a lot of people do. Yeah. So, as far as what this course of treatment would look like for oral probiotics, is this a one-off thing? Is it 2 weeks? Is it 2 months? What do you recommend?
It depends from any individual. It depends on the individual. So, I would say you can do studies shows that you can do 2 weeks treatment and then maybe a couple of months off. You will see. Because after 2 weeks treatment, you will see an improvement on your mouth.
Right. And as the average consumer, let's say, how would I find out if I need to improve my oral microbiome?
I can't say much because it's a topic that we are working on at the moment. However, I can just give you a little bit of it. We are working on a novel technology that will be able to tell you what's in needed and what type of normal treatment, dentist treatment or daily treatment you need to do to have an optimal oral care.
I want to dig further and I want to press you on it, but I'll be patient and I'll wait for it to be released soon. Fair enough. We'll have to have you back on the podcast when we know more. All right. Well then, okay. Speaking of what else you're working on in the lab at the moment, talk to me about the oral mucosa, because we do focus a lot on teeth. But are we working on anything that's good for your gums?
Yes. Gums, of course, is let's call it it's a surrounding. So you need to keep a health environment everywhere. So we are working on hyaluronic acid product on A or more. We don't know yet. Hyaluronic acid, I guess everyone knows that it's essential in skincare, and we know that in certain dental treatment, hyaluronic acid is used to reduce inflammation post surgery, and we are creating, or we have been working on product to assist a daily routine if you suffer from dry mouth, or if you are prone to have ulcers, or even just to have a very healthy oral environment.
Right. So are we talking high molecular weight or low molecular weight? Because I know that in skincare, the most expensive hyaluronic acid products will have both in it.
Yes.
Some of the more common ones might only have a low molecular weight because it's better at penetrating the layers of the skin. What's this product going to use?
We work on high molecular weight because it is able to mop up, let's call it what's called the ROS, the reactive oxygen species.
So the free radicals.
Yeah, the free radicals, which are predominantly in areas where there is a high level of inflammation.
Okay, so this inflammation, let's say you've got inflamed gums, has a high concentration of these free radicals?
Yes, exactly.
Right, so the inflammation that might be in your gums will have a high concentration of free radicals, right? Yeah. Okay, so why is it more beneficial to have a high molecular weight hyaluronic acid come into contact with those free radicals?
I can just explain in a very simple way. High molecular weight hyaluronic acid is fragmented into small fragments of hyaluronic acid, which then trigger the immune response to self-heal the area.
Right. No, makes enough sense.
Yeah.
So as far as the oral mucosa goes, we actually spoke on our last episode with Dr. Fadi Yasmin, and he brought up regenerative medicine. And he said that he personally believes that that's going to be one of the biggest advancements in dentistry within the next 10 years. I want to know a little bit about oligopeptides.
Yes.
Because I brought it up with him as well. And I know that you know a little bit more than I do. So I'd love to hear your thoughts on them.
I think it's going to be the future for oral care products. There is a company, the only company in the world which they discovered this product and they patented is an oligopeptide P11-4, which is able to attract and deposit calcium, which is present in your saliva, onto the tooth surface and doing this in a very simple way.
So we're talking natural remineralization.
Natural remineralization.
So we've got hydroxyapatite in our formula, which is synthetic. But oligopeptide has the ability to create natural remineralization.
Yeah, it's able to deposit. It's like a key to deposit calcium that is present in your saliva on the tooth surface.
I know for a fact that this ingredient is significantly more expensive than actual gold.
Yeah, definitely.
So tell me, how much is actually required to have any effect?
So they recommend around per treatment. If you look at per treatment, let's look at a milliliter per treatment. A milliliter per treatment of gel should contain around 0.5 milligrams.
Milligrams?
Yes.
Is enough to be effective.
Is enough to be effective.
Because I know that 1 teaspoon costs $220,000. So It's good to know that we don't need as much to be effective.
No.
Right. And is this something that we're looking at in future?
Yes, definitely. We are looking to different peptides. This could be one of the peptides. However, we know that in the last couple of years, there have been a couple of research groups bringing on the table different type of peptides, and we are talking to them to see what type of technology we can develop together.
It's unbelievably impressive, and it sounds like you're working on a lot more than just teeth whitening in the research center at the moment. And I know other than looking into peptides, you're also looking into color correction technology, which is something that's often found in purple shampoo for any blondes listening to the podcast. And from what I understand, it essentially works on wavelength cancellation.
Yes.
Right. And I want to hear a little bit more about the product before its launch in a couple of months.
So this is a serum gel that it's applied to your teeth. You can do it as many times as you want a day, and let's call it bleaching free. And is a purple product that once applied is able to reduce the yellow tone in your teeth, appearing much whiter after the treatment.
So it's a non-invasive way of whitening.
Exactly.
That's a good way of putting it. There's no bleaching involved. So is this a product that is designed only for superficial stains?
Yes.
So you surface stains. So it's like a tooth polish that you can brush your teeth with. And
I don't know if we can classify for superficial stain. It's a product that is designed for just to give a different appearance to your tooth.
Right. Okay. So you're cancelling those remaining yellow tones within your teeth by applying the complementary color.
Exactly.
Okay. So we got purple on one end of the spectrum, yellow on the other.
And in the middle, it's white. So it cancels each other out. And
how long does it take to produce a product like that in the research center from start to finish?
From start to finish, from concept to final R&D product is around a year. It took us around a year.
A year. Wow.
Yeah.
Are you happy with the result?
Great.
Yeah,
very happy.
I've seen it firsthand, and it's very impressive. Yeah. So you've done a very good job with it, and honestly, by the looks of what else is happening in the research center at the moment, the next 12 months is going to be crazy for you.
Yeah.
Very
exciting. A lot of product in the pipeline. Right.
So I've got a couple of questions for you, Mauro, and it's a segment we call Quickfire questions, and it's the way that we usually finish all of our podcasts. I'm going to ask you a few questions, and I'd love to hear the answer straight off the top of your head.
Okay.
Cool. Ready?
I'm ready. Shoot.
Yeah. Do you want a drink of water first?
Yeah.
Alrighty, let's jump straight in. Quickfire question number 1. Who is one person in your industry who you currently admire? This can be in the R&D sector, can even be in the dentistry sector, doesn't matter.
Let's go a little bit on the left side. A scientist that I really admire, and I have been listening to a lot of his podcasts in the last year or so, is Professor David Sinclair.
David Sinclair.
Yeah, I don't know if you know about him, but he has been spending most of his life. He's a professor at Harvard University, and he has been spending most of his life in investigating and developing a product to reverse aging process.
Wow.
Yeah.
At Harvard.
Yes.
Must be accomplished. We'll send him this clip as well, so we'll see if we can get him on the podcast with you.
Yeah.
All right, next quickfire question. Out of all of the new products that you've got coming in the pipeline today, which one do you think will be the most impactful on the industry?
We are not too far at the moment in the development stage. We are just early stage, but I can say that oligopeptides will play a very important role for our future products.
Right. I mean, natural regeneration is something doesn't really exist right now. So that would be massive for the dental industry, especially for enamel. All right. Next question. Mauro, in the next 5 years, what do you see one of the biggest advancements in at-home teeth whitening being?
I would say, I just can give you a little bite on this. We have been working for the last year and a half on a new technology to improve the oxidation of a teeth whitening gel. Mm-hmm. So this is going to be the future.
So new
novel technology to improve the oxidation process of the stain on your tooth.
You're leading me along here. So many secrets.
Can't say too much, but...
we're almost definitely going to have to come back on in the next 6 months so we can hear all about it.
Maybe 12.
Okay. All right. Well, last question, Mauro. For all of the young people finishing their degrees right now and coming into this industry, what's your biggest piece of advice for them?
Piece of advice, I would say, be humble, and you need to pick what you really love. Don't try to do something because it's a fashion or because everyone or mommy and daddy told you to do it. Just do something that you really love, because if you do something that you really love, you will achieve much more.
And don't cheat on your final exam.
Oh, you can.
Yeah, of course. Well, Mauro, thank you very much for joining us today. I've personally learned a lot from this, and I hope our listeners have too. I'm looking forward to having you back on the next 12 months so you can finally reveal all of the secrets that you've left with us.
Okay, thank you very much. Thanks guys for listening.
Thanks, Mauro. Thank you so much for joining us this week on Dental IQ. If you enjoyed the podcast, please follow us and leave a rating. And you can also find us on Instagram at dental_IQ. If you'd like to join us on Dental IQ or have any topics that you want us to cover, you can reach me at fabio@dentaliq.com.au. Thank you so much for joining us again. We hope to catch you next week.
Dental IQ is produced by Hismile.